Welcome to the Take on Healthcare podcast. Today we have a mind-bending episode lined up for you. Did you know that the placebo effect can be as high as 70% in some cases?
The power of belief can lead to real measurable changes in the body. Today, we're diving into this fascinating phenomenon that has intrigued scientists and healthcare professionals for decades.
The placebo effect challenges traditional ideas of healing and of treatment, from its accidental discovery around World War II to its subsequent influence on medical research. The placebo effect has reshaped our understanding of the healing process.
But it's not without controversy. While the placebo effect holds immense potential for therapeutic applications, its use in medical practices raises ethical concerns. Deception and potential adverse effects are key issues that healthcare professionals must navigate.
And here's something surprising. Studies have shown that even when patients know they are receiving a placebo, they still experience symptom relief. So what does this mean for the future of medical treatment and our understanding of the mind-body connection?
To help us navigate these intriguing and controversial waters, we have a special guest, Dr. Phranq Tamburri, a naturopathic physician and longtime friend of mine from medical school. His insights are sure to spark thought-provoking discussions.
So stay tuned, listeners, because we're about to reveal some surprising discoveries that could and should change the way you think about healing forever. So let's get started by exploring the history of the placebo effect.
You're listening to Take on Healthcare with Ted Suzelis and Mary Sheehan. Does the word placebo make you think of false medicine, or does it make you think of the scientific process? Is the placebo effect simply mind over matter? Keep listening to find out how placebos play an important role in your health and well-being.
So I think the history of the placebo effect is very interesting. Phranq, what do you know about the history of the placebo effect?
Well, as far as the deep history, not a lot as far as the deep history. I know much of it came into vogue with Sigmund Freud. That was kind of an issue we'll get into later. One of my favorite topics, because if the audience doesn't know, I focus on prostate health and men's health. So my favorite topic also is erectile dysfunction. Oh boy. But ED was a big deal because Sigmund Freud was one of the first to believe that ED was all mental first. Now, we'll talk about it later. It's a combination and how that plays into placebo. But it was around the 1930s, I believe, is when the first double-blind placebo-controlled studies are first brought onto the scene. And that was simply because of the response of this kind of eking into society, a lot from Freud and from France, from my understanding. But yeah, that was the early stages. Now, one of the questions is, how well did the ancients know this? From the witch doctors, the medicine men of lore, how much did they know about placebo? Because they didn't have the name for it, but they probably knew all about it. They started off, like many, with the heritage, their spirituality. And we'll be tackling these topics as well. How's placebo and the mind and the spirit, the religious connotations, and how you see the universe and your culture all come together. And usually the medicine man was like the focal point of all of that together. And so probably they started off as an apprentice, as someone who was part of that community, and then they became the medicine man. And this gets, I don't want to say controversial, but it gets into kind of like under the hood of these issues, which is, it's kind of like in magic as well. We'll talk about that, which is, how effective are you with placebo if you know the placebo is occurring? Right? Many times the doctor who believes in what they're doing does not believe it's placebo is more effective than those that know it's placebo. But when you start to understand how the mind works, you start to see the placebo effect of what it is. So my point is that healers have probably been aware of this in many ways through time, but the codification of it didn't occur until probably like around the late 1800s. Yeah.
I'm betting that they really didn't understand. They just thought they were powerful.
And I think, too, there's overlap. There's the culture, there's the belief, the spiritual belief. There's my power as, say, the patient, your power as the medicine man. Would you say, Phranq, that all of that is still present when we speak about modern placebo? Or is it simply, I take the red pill and I think my pain's going to go away, and it does? Like, there's a lot of things.
Oh, there is. let me throw it around. If I may throw a question back to you guys. The question is, for us in healthcare, what was your view of placebo? How did you look at placebo before you were a doctor? And then afterwards, how has that changed?
Oh, that's so interesting. I knew all about it.
Really?
Even as a kid. Yeah. I understood that there was a connection between what I thought and how I felt. So I've always been fascinated by placebo when I found there was a name for it.
Right.
Yeah. Phranq, why don't you tell us how your view of the placebo effect changed?
So first off, as far as with the audience, I'm not sure the background of your audience, but placebo obviously is for the intersection of the body and the mind. And I would think we would argue the spirit come together to harness the healing abilities of the body. And it does so in many ways. It's a powerful effect. As we've learned, the witch doctors knew about how, or they knew that it worked, but how is still magic at the end of the day.
Right.
It enhances as far as endorphins that's power of belief. We're getting into the biochemistry of it, endorphins, hormone effects, which then have downstream effects that just change the body and just healing. In fact, you could even argue in a different way. I have a 6-year-old daughter. I'm brainwashing with 70s and 80s old TV shows, The Incredible Hulk with Bill Bixby. Great show. And
Yes.
the first episode was all about a type of placebo. The fact that in the story, before he became the Hulk, he was not able to lift a car and save his wife. And then he began a pursuit of medical study to find out why there's stories of people, little petite ladies who in an emergency situation gain this immaculate strength and can do amazing things. And that's based off of reality. Is that a form of placebo? It's a type of harnessing abilities of the body that are not normally there. You can also include that as far as the mental energy, where they say we use 20% of our brain. My wife says it's less than that. It's about 20, 30%. And then at times, how do we tap into that other component? So there's so much more about the mind. And that's where placebo is just a term that we use as an umbrella of all of these elements coming together. And honestly, we doctors, we still don't know really what the heck is going on half the time, but we see this effect. So as far as with myself, it happened in a few different ways. I come from a very analytical background, and that's something that I think also is a hindrance when we talk about the effects or the factors in individuals or how to harness the placebo and the factors that are involved. We'll get to that later. But one of the issues is how analytical someone might be. Now, I'm a big proponent of the Myers-Briggs test. I know it seems a little controversial for a lot of people in the psych community. It's like a love or hate relationship with Myers-Briggs. I learned about it when I was a kid, and I actually was a counselor for kids. I was into it for a bit. I'm an INTJ for what it matters. But the core groups of people, how intuitive and feeling you are versus thinking and sensing, for those of you who are familiar with those, but the more not intellectual, but the more analytical you are, it becomes a hindrance sometimes for a placebo. Same thing with hypnosis. If you are susceptible to hypnosis, not everyone is to a certain degree, but the more analytical in some ways, you don't fall under the spell as deeply as those that not. It does not mean they're weak-minded or anything like that, but it's the mindset. So I came from that background. I was a real Carl Sagan fan and amazing James Randi, and it was all my background. So the last thing I ever thought it'd ever be is in a naturopathic medical school. That was a whole journey for me to be buddies with Dr. Suzelis here. But one of the couple of things that led to me in this journey, number one, is that I have Tourette syndrome. And that's, as Ted knows, very few people know, but when you're in medical school with me long enough, Tourette's gets me out of jail if I can say bad things to police officers and not get arrested for that one. So that one's good. But as far as the Tourette's, it's something that it's frustrating. It's like having Parkinson's. It's actually the opposite of Parkinson's is Tourette syndrome, where you have the one thing I'll never get is Parkinson's, is that the brain does things that you're not thinking. It's like almost like Parkinson's. You're not thinking of a tremor, and yet it's happening. People have neuropathies, or I'm sorry, neurological issues. They run into this where suddenly their body is not doing what their mind wants it to do. And that was very perplexing for me, someone analytical thinking, well, why can't I control this? And yet I could. Tourette's is, you can control it, you can't control it. So I learned quite a bit about having self-relax and meditative in order to control my own Tourette's so I could try to do things in the future. I used to stutter all of the time with my Tourette's. And I realized if I wanted to become an attorney or a doctor in the future or a public speaker, that would hinder me. So it was a lifelong journey for me to try to temper the Tourette's and understand my mind. That led to another event. And that other event was when I was pursuing to become a surgeon at the time. And I was so anxious to become a doctor because of my Tourette's. I'm not making this all about me, but it's harder to read. And many people with Tourette's never even make it to college. So it was an uphill battle for me academically. I did well, but not A+. But the thing is, I needed to be around blood in order to try to get into medical schools. So eventually, when I was around this time, I got a splinter in my, I was making the bed. I got a splinter in my nail. And the doctor who I went to, the family doctor, he was in a rush and he just pushed me down, injected things in my finger, and he just cut off my nail and didn't even tell me what he was doing. Wow. And I went into shock. Because I was never afraid of needles before, but the experience of the alcohol and him sticking it in me, and I went into shock. So he sent me with my mother to an allergist to find out whether it was the anesthesia I reacted to or something. And then they put more needles in me and eventually found out I had needle shock. And what started to happen is that the more I was around blood or trying to be around medical settings to get experience for medical school, I began getting more anxious. And then I would pass out if I had a needle. Then it got to the point over time where if I had a needle for just a dentist, I would pass out. So I would refuse to get Novocaine and just say, just go do it, right? Then that led to, it got worse because you keep thinking about it. And it led to another problem where I would walk into a room and smell rubbing alcohol and the smell of alcohol associated with the needle. And then I passed out from the smell of alcohol. And then I tried to become an EMT, and then we were just training with EMTs, and they were checking blood pressures. We were teaching each other blood pressure. I was hanging with my friends, and just having the blood pressure cuff and then the pumping and feeling my blood pump, I passed out. And then when I passed out, then the head of the ambulance said that I went into a seizure, which I did not. They didn't know what it was. And since they claimed I had a seizure, then they banned me from being on the ambulance. And then I had to go, and it just turned into a whole thing. Sorry, I'm not trying to make this my life story, but
no, of course not.
It's the power of the mind. And what infuriated me was that I was finding my mind was entrapping me, and it was going deeper and deeper the more I was trying to get myself out of it. And I was pushing myself deeper and away from the dream that I had of becoming a doctor. That was the irony. And so I did everything to fight against it. And I would, I remember sitting in just the power of the mind is what I'm getting to here.
Right.
Eventually I had to beat myself at it. Ted doesn't even know the story. And I knew I had to get around this. And eventually I got a job doing organ transplants and body disarticulations and research tissue. I went all the way to the other side and I was hired, but they didn't know that I almost passed out during the interview because I knew if I got this job, I would be set for med school. And the couple days before, I did everything to sedate myself I knew if I get through the first day or so, I put the blood pressure cuff on me. I would poke needles like I was poking myself. I did everything for a couple days to just oversaturate my brain to get past that. And I survived the first day or so. And after that, it was smooth sailing. And the experiences I've had since then, amazing. But that was a hurdle of the mind. And the fact that I was fighting so much against my own mind to get into a conventional school that's all about drugs and surgery, eventually I stood back at some point and said, what the hell? This is the mind. I'm fighting my own mind.
Right.
And then you go back to placebo, the power of the mind and the body. And here I am at my own example. If I spent more than 2 seconds looking in the mirror while I'm poking myself and smelling alcohol. Then right before I had that job, the one other job I forgot to mention is I worked in the pharmaceutical industry Hopefully Ted doesn't yell at me too much. And
I
that
knew
was
this,
at Merck
Phranq.
Pharmaceuticals. Yeah, you know that. So I did phase 4 trials, the phase 4 trials for Merck. And Mary, you might be familiar with how that works. So that was at Merck. And I was working for them for a while. And you spend all your time doing these phase 4 trials. And of course, you're doing basically the cleanup work from phase 1 to 3. And you sit back and they would have, you realize all the trials are about what? They're essentially, when you get down to it, they're double-blind, placebo-controlled trials. And so all it is, these companies spending billions and billions of dollars to prove that their drug works better than the placebo.
Right.
Because if it doesn't, it's not cost effective. So it finally hit me that you have these conventional people who don't believe in the placebo, or at least they poo it. But yet the whole modus operandi, and with billions of dollars and all of the research, more research than any naturopathic, we could talk about the alternative community, talking about placebo all day, but the people who have all of the evidence and all of the research and billions of dollars on the placebo are the drug companies.
Right.
They have them in their vaults.
Yeah.
Every drug that makes it to market means it had to supersede the placebo. So at some point, I began to realize that it was right in front of us, the power of the placebo, but we're constantly in denial for economic factors. And I'm not beating up on the free market and drug companies. That's a cheap shot. I get it. But that was where those three came together. And then there's one other, but I'll skip it for later. But just to give you a preface, and that is one of my hobbies. One of my hobbies is, especially helps out, I got a young daughter now, is I do magic. I do illusions. And I'm, let's just say, I'm not around, especially being Italian as well. My friends don't want me around a card table. They've seen what I do with my hands, so they don't trust me. But the power of magic, which is another conversation for later, is, I think, what put it over the edge. There is a book, which I pulled out of my library. It's one of my first favorite books. I don't know if you read it backwards, but it's called Flim Flam by the amazing James Randi, which is all about critical thinking about just, parapsychology and different things. Not that I think he's right on all these points, but James Randi, the amazing Randi, was a famous magician who would bring up any of these things we'll talk about later, about faith healing, how magicians, there's magic, and magicians have a hate. I mean, it's two sides like we see in the world today about things, but magicians hate faith healers because in their mind, they're using the art of magic and they're using it to fool people. But then on the flip side, you could argue, are you fooling someone if you're using their body to heal themselves? That's placebo. Now, where the issue is if you're taking their money, right? That's where the magicians have an issue. They're exploiting their craft. But those are the two sides to the equation. So all of that come together into like a nexus point is eventually made me just throw away also I didn't want to be a doctor when I realized that medicine was changing and there's economics and things like that. So I gave up medicine. I went off to school in Japan. I graduated from Kansai Gaita Gaku. And after that, I lived at a Buddhist monastery for a while, hence my ponytail I still have. So I have a more Buddhist perspective of the world. Came back from there and saw how they saw the world and all of that together. And I had kind of I won't say reawakening, but kind of a reforging of stopping resisting from a Western perspective of medicine and kind of learn to just move and move into a different mindset, which is placebo. We're not placebo, but integrative medicine, mind-body medicine. And one last point, I'll throw it back to you guys. I know I've been rambling. I know Ted, sorry, Ted. But that was the Buddhism versus a Judeo-Christianity or Western view. And I bring this into my practice often, especially when I deal with prostate cancer. So I'm dealing with oncology and cancer patients, and that's a whole another world. A Western view of medicine often, and this is a little bit what I was mentioning, is if there's a nail, give me a hammer. If a patient says, I have prostate cancer, I say, well, what's your goal? Well, kill it. We get rid of it.
Right.
So, okay, well, we'll rip out your prostate. We'll get to it quick. So that's a Western view. Whereas a Buddhist, or you can say a Taoist view, and there's other different faiths about this, but they're a little bit different. They'll look at it instead of equal and opposites, or let's take it out. A Buddhist perspective will learn of acceptance or learn to live with it. Doesn't mean that you give into it, but you're moving with it. It's like the flow of water. Instead of trying to stop and be the dam, you move with it. And those are all the components that I saw that I could see the harnessing of the mind, but also in a way to keep your integrity and not fool people. And that's the line, as we'll talk later, about the ethics.
Right.
So anyway, that's my background. I know it's a story, but it was a journey.
Yeah, that's great, Phranq.
How about you, Ted? But you kind of cheated because you had great parents who taught you this ahead of time, didn't you?
Well, like I said earlier, I really didn't know much about the placebo. Before medical school, I knew that there were placebo-controlled trials. I didn't really get it that well. I understood all of the natural medicine end of things, but didn't really understand the placebo factor. And so it wasn't until medical school that I really understood that much better. And so with that, it's just like every doctor, you tend to think that the placebo just muddies the water and it's not really something important. It gets in the way. And because the studies were supposed to be able to eliminate the placebo effect to understand what the actual drug effect or an herb or whatever it is. So it wasn't until much later that I understood that there was something beneficial. And actually, I think even probably more because of talking with you, Phranq, that it changed my mindset to understand that there could be something really good with the placebo effect.
So then I'm curious, on that note, how did you incorporate it into your practice then, since you had a change of opinion on its value as it was a hindrance and now it's a help, I assume you're saying. So how do you capitalize on it, I guess?
That's the interesting thing here is that I don't think I really have so far. I've understood it and saw some of the value, but I felt ethically that I shouldn't be trying to lean into the placebo effect, that I've always tried to just make sure that it's the medicine that's working, not the placebo part. And doing the research for this has really even more changed my mind to think that, okay, maybe I'm missing a piece of this. If we're doing it ethically, that I could actually help patients a little bit better by leaning into some of the factors that would allow them to have a placebo that worked better.
That is so fascinating to me. And I think it's because you came up and like Phranq in the alternative arena, and I came up in the traditional, knowing very well about the placebo-controlled double-blind study. I have tried to maximize the placebo response.
Yeah.
And I try to be the medicine. It's kind of like what Phranq was talking about. Like when I give antibiotics to a kid.
Yeah.
This is going to make you feel so much better. And your mom cares about you so much to pick up this medicine, and your doctor loves you, and just whatever I could say to make them feel so good about it. Because a lot of healthcare is very scary. I think Phranq did a great job of explaining how scary healthcare can be. And I don't think that helps anyone.
Right.
So I've really always used it. Hearing how Phranq talks about it really makes me appreciate how I've tried to incorporate it, because I always had a problem with the fact that these drugs, many of them that I'm giving out, are not that much better than a sugar pill.
Right.
Yeah.
That is definitely interesting with that, because it wasn't until doing the research for this that I really understood that the placebo doesn't disappear from the medicine. So you have the placebo part of the trial and the medicine part of the trial. I didn't understand that the placebo is still working there.
So it's both.
Right.
It's a very Buddhist approach.
Yeah.
So on that note, Phranq, how it's both. I hear you talk about these things, and I just wonder practically, how do you get like a patient to accept both? That yes, you're sick and you want to get rid of the disease, but you have to go with the disease. Like, how does that work practically?
So how to bring it into a modern practice, or how I utilize placebo? Is that pretty much your question? Okay.
Yeah.
So let me do it in three different ways. One is, I don't know what order I'll do it, but one is the problems that you have in today's system, which doesn't allow it, and how do we try to combat it? The other, I'll give you an example from a urological, more a way that I do a fun presentation to my medical students, showing them how this can work. And then thirdly, the cancer component, because cancer and placebo is or any type of serious disease, something with a high mortality, when you're confronting your own mortality, That's a different level. And those are three different types. The one is, first off, what are the problems? And the first is, as Ted knows, I'm no big fan of the government. I'll just leave it there. And government healthcare, which is why I do what I do. I went away from the system, right. And that's just a whole nother level why I became a naturopath, cash pay, the whole bit. That's a whole nother story. But the thing is, not only is it because it, relatively sucks, I'll just use a medical term, but there's a lot of hindrances to the placebo itself. So when people are finding that they're not getting as well, we could go all day about limitations of healthcare system and blah, 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 and drugs and whether they were effective. And all of that we'll just put aside. That's like called a Tuesday, how we would all agree. But as far as placebo, the first is a government or insurance visit is 10 minutes, right? That's the first problem. You can't, you need a bond right. with a patient. You can't do that in 10 minutes, right? You have to be, right? It's the first thing. Second problem is you have to, how do I put this? Talk to your patient, right? Which means you don't have the PA go and do it for you. Nothing against PAs, but and if you're trying to see the PA, then that's fine. PAs are awesome. In many ways, I'd probably prefer PA humanity over a doctor or the regular MD. So I'm not playing that game. I just mean, I hear all the time from patients who they are told to see this doctor, they go to see that doctor, and then they go to see him, and then they get the PA or somebody else. Now, from a placebo point of view, you're being told to see this person. This person's my doctor, right? And then you get someone else, like the underlings, how they just see it, right? Not getting the ability and all that. So that just sucks it away. That sucks away a huge part of the sense of healing that, well, maybe I'm not getting better, but if I was able to see the real doctor instead of the assistant, maybe I'd be getting better. So you're already losing that power of the doctor, right? The third, and that plays into this too, of the doctor. What do you think placebo in many ways is? It's the witch doctor, has all the feathers and all the incense and things that I'm not mocking it, but that's part of it. Well, we do the same damn thing. What do you think all those diplomas are in the back of our wall? How many pieces of paper, little seals on it? It's the same thing. And then instead of the magic wand, you go, ooh, like that. You know what the magic wand is that we use? Well, maybe you, Ted, maybe we don't use.
Stethoscope.
Well, yeah, that's a good point. Stethoscope. But you know what a naturopath doctor...
The white coat.
Well, the white coat, exactly. The white coat instead of the feathers and all, and instead of, because I get in trouble because I don't wear a white coat. I wear like scrubs and my cowboy boots for my motorcycle. My patients don't like the white coat, but that is part of the persona. But Dr. Sensenig, who is a very classic old school naturopath, Dr. Suzelis knows I'm talking about. Our first day Ted and I met each other was Dr. Sensenig, who welcomed us to the long, arduous journey of being a naturopath. And he's the one that pointed out that we don't have the shakaraka little wand, which is to be respected of our ancestors. We have our own. Do you know what that is? It's called a pen and a script pad. You pull out the script pad, and this is the magic device. This is now, and you write it, and so your magic writing, you peel it off, and here you go. And you're transferring that power in the form of this script. Now, when you're a naturopath, it's like, oh my God, it's like poison. And we have a different viewpoint maybe now, but it's a concept of how you apply that. Going back to the things of modern medicine is, like I said, the choosing your own doctor, the 10-minute visits, and then, and also just looking at the patient. I mentioned, about talking, but just looking, even if you get your doctor, do you know how many comments I get when, of course, my visits are kind of long because I do prostates for hours. We have like a couple hour visits. The other day, we had a 4-hour consult with my patient and his wife because my patients, not to get in my practice, but we have patients, half our patients fly in. They come from other countries and states, and we have a love seat, and the husband and the wife come in, and we set the time hours to really dive into this. So to really harness this whole effect, to really hear them on both sides. But I hear so many times, aside from the fact that their visits are usually 10 minutes, is the doctors don't even look at them. They spend the entire time looking at the computer. After I say hello and the patient's there, I just put in like their email and basic things, and I purposely do this. I close the computer and I sit back and I'm listening right in their eyes, and I never lose eye contact for the first 10 minutes. I let them just unload whatever it is they've been spending months to come in to tell me. And that I know is all right there a bond of with the doctor and the healing process. But to not even give eye contact, how can you have a placebo effect when you're not even bonding, even eye contact with the patient? So all of those things, they propagate each other. They kind of have a synergistic effect that just, you can't even start to have a placebo effect from that perspective. So that's the first thing. The other, I said another as far as how we might bring it to the practice. So let's talk about erectile dysfunction. And for you guys listening, I just want to point out that ED does not mean what you think it means, okay? Let me be clear, this is a little definition term. Erectile dysfunction means it don't work at all, right? They ain't happening, not at all.
Right.
That's different than what's called erectile insufficiency, which is what most men have. It means it works, just not the way when you're 25 and get into that. Just to be clarify, there's a difference. But going back to when ED was first recognized as a problem, it was one of those things people didn't really talk about, A, and B, people didn't live long enough to be worrying about it, and it was a different time back then. But Sigmund Freud was the first to say that it was a mental disorder. It was the mind that was creating ED, and that was pretty groundbreaking in its time. About 50 years later, around the 60s, 70s, whatever, it changed. And the viewpoint was it was not psychological. It was all physiological. Once we started to understand how erections work, and believe it or not, erections are pretty complicated. We thought they were simple, but they actually are pretty complicated, ladies. Just tell you, I think guys are simple, but that part is a little involved. But with that said, we went from one extreme to the other. And then it was around the late 80s, 90s is when we have the current consensus, which is that it's both. That ED almost always starts, most cases, as a physiological issue, but then quickly carries on the mental on top, which is usually in the sign of performance anxiety. And so Dr. Cruzel, another flashback, Dr. Suzelis, had told me that as much as we're naturopaths, sometimes the problem with ED is that guys come in, they just want an herbal pill instead of Viagra. And that's green allopathy. But ED, not to get in the whole thing on ED, but it's really not even a urology problem. ED is almost always a side effect of something else, diabetes or hormone imbalance or stress and anxiety or polypharmacy or poor heart output. I mean, none of that's a urology problem when you get down to it. So trying to treat the underlying cause is a lot of work that is not a simple pill. But if a patient comes in to see you and they're paying cash and they're a little anxious about all this, if you just sell them a bunch of supplements and then they're expecting a result and it doesn't happen, then they get frustrated. They spent their money. They're probably not going to come back to do your whole battery of tests to work on your heart and diabetes when they're just there to have an erection. They don't need all of this other stuff in their mind. So in order to get them to come back as a patient and to make sure that the performance anxiety now doesn't take over, because when they spend cash and your herbs don't work, or L-arginine, which is a good one, but you got to use it properly. But when you do that and they don't get the result that they thought, then they think there's something deeper wrong. And then they can spiral even further down, like what happened to me trying to get into medical school. And I'm very sensitive to that. So is Dr. Cruzel, who is completely anti-drug, he said, yeah, just give them Viagra. I said, what? And he was right. He said, give it to them right away because they know it works where we know it works. And it's like no real side effects at all. I mean, the only side effect we thought originally was there was a notable increase in heart attacks after Viagra came out, until we did the second study and realized the heart attacks because all these old dudes are having sex for the first time. That's why they're having the heart attacks. It wasn't the drug. So after we got past that, it turns out that Viagra, and I didn't get a free lunch from them recently, but these medications are something that they can take it within an hour, they get a result. They can see that the plumbing works. And as long as they have that, then the mind doesn't start to take over. And now you have them as a patient, not in a, calculating way, but they'll come back to now try to treat the underlying cause if that's what they want to do. And then you can build from there. So that's another example of trying to harness placebo maybe in the other way so it doesn't go down the other direction. Then when I do get to the natural treatments, something like L-arginine, which is an amino acid here that you can take. It increases circulation. It's great for diabetics, which happens to be the #1 cause anyway of ED. But anyway, L-arginine is a good example. So what I would do when I would teach my students, I'd say, look, don't just do what you go. I'd say, okay, well, here's some L-arginine and here's a bottle and you can take this and it's $29.99 and all this. No. It's like you say, look, here's these bottles that help with ED. But there's these other companies and this and that. But here's these newer companies that have the increased purity. Talk about that, not to hype up a company. And then I'll say, look, these are pretty powerful. I talk about how athletes, Dr. Phranq, by the way, used to give L-arginine as an IV to the athletes in the NFL. And they would all be raving in their locker room and how much they were scoring also at home, right? So they're all the L-arginine. So I would tell this story and say, look, it really does work. It's powerful stuff. So here's these supplements. Now, I'm only going to tell you to take one. You just take one, just try it out. This is going to be pretty powerful. And I'll take the capsule, I'll put it in my hand, and in my hand, I'm like, my hand's shaking. Look at the power of this. Oh my God. It's like, just so you know, just take the one. Now, two you might be able to do, but just be careful. You take two, you might get a little lightheaded because of the blood pressure. Just be aware. So make sure if you're going to take two, try the one first, and then the second, maybe take on a weekend where you're not driving, just in case you might feel a little lightheaded. And sometimes that can happen over Rauwolfia, some herbs I actually do that with. But so this is just an example where I don't try to ham it up too much, but I want them to know it's not just a supplement, because already supplement has connotation for some people trying to get past that. It's not real medicine. How many times are Ted and I, our patients say, oh, I love Dr. Suzelis, especially compared to my real doctor. How many times do you hear that? Wish I had $1 for every time I hear that. So already,
and then every once in a while, they'll actually say, oh, I mean, you're really a real doctor too.
I know. It's taken me years. I know it's just not to go Italian on them. I mean, it's a reflex. But no, I understand it already that there's that connotation, so you have to work into that. So that's as far as the supplement and how I'll utilize in different herbs. And some of them really are that powerful, to be honest. But I utilize that so there's a respect with the medicine that's coming with it. So that's another example, and I'm sure we have our own ways of doing that there. And then the other, you're talking about cancer. And so this is kind of a loaded topic. And so if you guys want to jump in on this one, but I'm going to bring this up. I have in my notes, when we talk about placebo, and we can get into all the research studies and all that, but I'm going to talk a little deeper about something that was very enlightening for me. And that deals with religions. Where I come from a Buddhist background, and just to be clear to the audience, I am not promoting one religion, this religion, people get sensitive about everything today, and that's not me. That's just the way it is. So I'm just talking what I see, and I bring this up to my students too. We have a very popular class. It's the very most politically incorrect class in the Southwest, and we do it because sometimes you just have to know what you see in the front lines. And one of the things I learned was, first off, the power of religion or spirituality, but actually some of the studies have shown religion even over spirituality. There's a doctor, and maybe you guys are both familiar with, his name is Dr. Seligman. You familiar with him? He used to be the president of the whole psychology association, National Psychology Association. He was very well known and respected, like for 20 years. He was like this guy. And he eventually became the head of the psych department at University of Pennsylvania. And he created the first ever, and still today, the first only PhD level program in the study of happiness. 60 Minutes did a whole thing on it. And by the way, all the research is free online. You can go on University of Pennsylvania right now and happiness studies. And whenever you see like a story on 2020 or whoever, Oprah's doing a story about happiness, usually they're the go-to people. And when I say happiness, I don't mean in some food, let's all hug and all this kind of thing, which is good too. I like to get a hug. But it's the actual research behind what harnesses happiness in the mind. So happiness, and this is kind of important because it plays into the mind, how you can harness it. Happiness is the opposite of, see, what they realize is that in basic medicine, we talk about disease, and in naturopathic medicine, we say that being healthy does not mean just the absence of disease, right? Right. You have optimal health, and then there's disease. So basically, we know in physical sense that if you're just living, it doesn't mean always you're healthy. We might think we're healthy, but optimal health is different than just the absence of disease, right? We kind of learn that in school. So there's disease, there's like basic walking around, and then there's optimal health. Well, in mental health, it's the same thing. They just didn't realize until Dr. Seligman really made a thing about it, that they focus on in psychology and always the problems, schizophrenia, depression, whatever. But what is optimal mental health? Is it simply just not having schizophrenia? No, it's the opposite, which should be instead of optimal health. That is what happiness has been defined as through them, is another level. So therefore, how do you achieve optimal mental health, or we'll say happiness? So it's a fascinating program. I can go all day on this one, but I'll keep it simple, that half of happiness we know is genetic. Right off the bat, half of it's genetic. Wow. We know that with twin studies, where twins were separated at birth, and then they find themselves 40 years later, and they're happy twins. You know, we see them all the time. So half of it is just genetic. Some of us are just born. Heck, mothers will tell you sometimes one baby is just born happier than the other one.
That is true.
Can tell. I mean, Ted's wife, how many kids do you have, Ted? I forget. You have two kids, 3 kids? Anyway,
two.
So 2. There we go. So yeah, you might be able to tell. So then the question is, what do you do with the other half? How do you harness that part of the mind and the other half? And that's a whole thing in itself, but a lot of it comes down to how much control do you have in your life.
Right.
With babies, they can tell is if you give a baby the ability to pull a lever and see something, they like it. If you take away the ability for them to see it, then they get more unhappy. But what makes them really angry is when they pull the string and then the stimulus is random because they're not in control of it anymore. And so that makes them even worse. And we see that in societies, when we see what type of happiness societies are happier. It's the countries that were the ex-Soviet bloc nations. Lithuania was like bottom of the list of the most unhappy countries. And because there was too many controls. And yet the happiest people on the planet, I don't know if you know the happiest people on the planet. Are you still there? There you are. You're moving. Okay.
Yeah.
The happiest people on the planet were the Kung Bushmen of the Kalahari Desert. They were the happiest people. In fact, they made that movie, The Gods Must Be Crazy, if you remember that movie, about the African man that found a Coke bottle in the middle of the Kalahari Desert, and he brought it back to his village, and he was the only person that had something no one else did, and that Coke bottle made the entire society fall apart. It was a funny movie, and it was talked about in naturopathic school. I mean, you should check it out. It's famous. But anyway, so then, in other words, owning things didn't mean anything. It was society. It was having a group, a community. It was, and a lot of it came down to sense of purpose, and with religion and spirituality is what they found. So I'm not to get too much off topic, but it showed the power of the spirit and religion in societies that have it, and they're communal, right? So the religious part, I find, and this is coming from not a religious background originally, is the power of it. I used to think spirituality, and I find myself a spiritual individual, and I'm a little skeptical of organized religions when I was younger about it, but I started to recognize the power of organized religions, or at least the communal effect. So, for instance, in a Muslim country, all at once, everyone bows down to Mecca, and everyone is calling out Allah. You're around, you're surrounded by it. The power of that culture, of that religious spiritual view, is focused all around you. And most religions, most cultures and their religion, you're surrounded by, you're immersed in it. We talk body, mind, and spirit. Well, the spirit is a huge part of it that's often cultural. Where America and Western societies are starting to have an issue here, and again, we have 2 separate things here. As Americans, and with the First Amendment, and we get all that, separation church and state, I get it, completely agree. I put on wave my flag, that's the way it is. But when I take that Uncle Sam hat off, and I put on my doctor hat, and just look at it clinically, cultures like ours have a problem, because we kind of subvert and push away our different religions because of religious freedom, so to speak, but then we push it down. We push them down. And when I taught a class on this, I would say Buddha and say, no one really cares. And I'd say, I don't know, Siri Singh Sab. And I would say these religious leaders. And then I would say, Jesus. I would say that. And I said, I know people in this room are probably getting real uptight, and you shouldn't. I'm just saying a word. But my point is that we're living in a society where these kind of terms, because there's a lot of issues that we're dealing with, we say, push that aside. I don't want to hear your religion, this and that. So we're not around it anymore. And people are not seeing it. They don't live and breathe it like in other cultures. And so what takes the place of the religious aspect? Remember, this is going back to placebo and harnessing the mind. It's a loaded topic. You're saying, dealing with cancer patients, what are the things I deal with? So I didn't lose sight of the question. But that's the issue, is how do we harness it? And even in the naturopathic medical school, where we learn body, mind, and spirit, well, when the heck are we getting to the spirit part? You're not even going to talk about it in a naturopathic medical school. Right. Because I don't offend anybody. Well, then how do you deal with it? And how do you approach that in a visit? Let alone if it's a 10-minute visit. So it was, that was the context that I realized there was power in it. Now, what takes its place? Consumerism? The media? I mean, like where do we go to get our spiritual rejuvenation and the bonding with others to feel that you have a foundation? Why am I bringing this up? Spirituality is great. And yes, for me, maybe it's good enough. I'm going to get into our own personal views, but I have learned to harness placebo. The people who do the best are those with organized religion backgrounds, or they've been immersed in it for a long time. And I have found, like, the people who are the most religious. Remember, I'm seeing people, prostate cancer, I'm dealing with older men. I'm not seeing younger people. I'm seeing older guys. And by that stage of their life, they're either secular or they're religious. They've stayed with it a long time. And you start to see this divergence in patients. And I get pretty intimate with my guys, and I get to know them pretty well in all sorts of ways. And it creates a bond, if nothing else, for liability reasons. Because if I'm going to help a guy not do what the conventional system says about cancer, I need to know that we can have an open conversation here. But I'll tell you what I started to learn. I would talk to patients, and every once in a while, I have a patient and I have to give them really bad news. And I'd say, hey, you have a prostate cancer. Most prostate cancer doesn't kill men, but yours very well could. And I would give a few explanations why. And most guys like, okay, well, let's talk about the surgeries and this. But I would have sometimes a man and his wife, because I don't have one patient in my office. I have two patients in my office and deal with prostate, two patients. And sometimes they would just sit there and go, okay, I understand. And well, maybe you don't quite understand. There's Gleason scores, and I would do my whole thing about there's Gleason 6, which is low aggression, 10, and I would do this whole thing. So here's the bell curve, and here's where you are, and this is not a poodle cancer. This is a pit bull type cancer, and the mortality rate is different than what you're reading about online of what your friends are talking about on the golf course, and here's why, and blah, blah, blah. And they say, oh, yeah, no, I understand. That's all fine. Okay, maybe you're not quite hearing me, and I would do something else. And without sounding, and I started realizing I didn't want to sound condescending, but I started finding myself doing that. And I didn't mean to. These are very smart, educated guys coming in. And I used to think that they weren't hearing me. And after years of doing this, I began to realize, and now I can kind of pick it out, that many of these men they're deeply religious. And I will say, and this is the last overly controversial thing, maybe if you're a show, you're going to edit it out, it's fine. But remember, I'm coming as a Buddhist perspective. I'm not dealing with different religions, but I've seen people with all different religions. I will say that the groups that secular people have a real hard time dealing with cancer. And I've learned it's because many times we don't have a foundation of our mortality. Many times we've never confronted our own mortality. For a lot of the guys that I see, and probably you guys see, I don't see the typical 65-year-old that's on 7 or 10 pills and they smoke and this and that. Most patients who are 65 in my office are healthier than 35-year-olds because they're very natural minded. They're working out. They're paying cash to see a naturopath at age 70. Yeah. So they're very healthy. Many of these men have never seen a doctor, or let's just say they've never had a serious health problem. Right. And so therefore, when they're first confronted with it, I tend to be, God help them, but I tend to be the doctor, the first person in their life who they are looking at when they are being told that this endless life that we think will live forever, and there might be an end date. And that's something you have to really, it's powerful moments in the office. And I have found that secular people have a harder time with this, sometimes the deer in the headlights sort of thing. And I have to give myself enough buffer, because if they understand their mortality, sometimes they get in panic mode and they start making rash decisions really quick, which is often not in their best interest. But for liability, I can't just tell them not to do it. So I have to figure out when, like a poker game, when I'm going to lay out certain information, teach them that they're not going to die based off of a certain amount of time, and then slowly open them. And so I work with the parameters that I get from patients and maybe what I glean from a religious perspective. But then I find that people of most religions, general religions, are somewhere in between, versus the one group that I have found that seems to honestly handle it the most aplomb and just at peace with it. And I'll just say it. It's the people, I would say, who, and God, I'm going to get in trouble with it, but it's people who follow Jesus mostly. I am not trying to promote one or the other, whether it's Christians, Catholics, Mormons. We have a lot of Mormons here, LDS here in Arizona. And it took me back. I could see a difference. Not that where I'm asking their religion at first, but it often, they will bring it up or it comes up. And there's something different when they're confronted with their mortality. And it's been kind of a beautiful thing to see, just to see it on the office, just how at peace. And I don't see that with other faiths, man. Doesn't mean that they don't. I have Sikh patients, other groups, and I think religion and spirituality ultimately is very beneficial. But there's something about maybe and I'm not the scholar, trust me, I'm not coming at this as the Bible scholar, but whether it's the people talk about finding Jesus or the bond or whatever of that sense, that seems to be different somehow. And somehow it prepares them to deal with these issues better. Now, if you are a religious follower, it's pretty obvious why, right? Well, it's because Jesus and well, there's not much else to talk about. So I'm going to respect that for those of you who follow that. And I'm not doubting that. For those that are the atheists and the secular people, they'll see it as it's an intellectual study. It's like, okay, well, what is it about? This is what after all that, thank you for letting me say all that. But that's where, from a placebo perception, and I'm not in any way trying to insult saying it's all placebo, but what is it about the belief in that viewpoint that allows this comfort and to be able to open up and respond to the placebo? I hate to call it placebo in this case, but it's just they heal and respond better to natural treatments. And I find, or at least be more open and suggestive to things, but they're at peace. They don't go into the panic mode as much. I know it's a loaded topic and I'll leave it there, but it's been like 25 years. How long have we been doing this, Ted? It's been like 22, 23 years. And you start to see this. It's funny. I'll end on this. I'll throw it back to you guys. I tell my medical students that when they graduate medical school, they're technically doctors, but the only reason we give them a board test is to make sure that they don't kill anybody. That's all it is. So you're just getting started. That's all it is. You're not going to kill anybody. Don't embarrass us. And then the next like 30, 40 years, we call it a practice for a reason, because I'm still making this stuff up as I go. So that's called a practice. We don't say plumbers are in the practice. It's a trade, but we're practicing along with attorneys. And then by the time you get to retirement age, you finally know enough to actually say you're a real doctor, and then you retire. And the cycle begins. So it's like it takes your whole life to see these things that go beyond the data, go beyond the technicals, and these experiences that you see. There is a saying, this sounds cliche, it's a Greek philosopher. This is true. It is true. His name was, or her name was lost to history in the fire of Alexandria. And it was a reading I read in it was a medical text when I was pre-med. And I was trying to decide what career to go into. And medicine was like one of three things I was looking at. And this philosopher made this quote, and he said that there are three things that you can do for a human being that will forever change your view of humanity. Three things. And the first was to become a mother. That was the first, that it just changes everything about how you see the world. The second is to be a soldier during a time of war and to be shot at, or you come from Philly or Jersey. And then the third was to become a healer or a physician. You know, the fact that you're seeing human beings from the inside, literally at times, to the outside. You're seeing them from womb to the tomb, the whole journey of humanity. And you're seeing people at their worst, or I would argue often at their best. being confronted with cancer or whatever it might be, and with their families, and you're seeing all of their whole life journey sometimes coming together in your office, the mind and the spirit, as we're talking about. And hence why placebo, which the whole topic is about, is just this definition of the harnessing. But it's not something that easy even for a research study to say, here it is. We have double-blind placebo-controlled studies, but there's a lot involved with it. And I think being a doctor it's a beautiful journey, like that philosopher said. I'm glad I chose it. Even if I don't make millions of dollars, it was a hell of a journey as a human to see through this profession. But the placebo is something that I was happy I saw enough of it to get myself into this field. And it's a journey along the way to see it in different manifestations.
So one of the research that I've been really interested in with this research for looking at the placebo effect, her name's Alia Crum out of Stanford. And so she's doing some really neat work trying to identify the placebo effect and mindsets that could be involved in the placebo effect. So with her, she looks at there's 3 different pieces of the placebo effect. The first is the body's natural ability to heal. So if you had a form of your trial that had no intervention, you're going to see some improvement there by nature.
And I think the allopathic system doesn't even acknowledge that, but interesting.
Right.
Okay, yeah.
Right. Then you have the mindset.
Okay.
So this is your core assumptions and beliefs.
About healing particularly, or just core assumptions and beliefs about life? That's a big term. Core assumptions about what? About healing.
So talking about healing and the therapies you're receiving.
Oh, okay.
Yeah, so it's how you view the therapy and everything.
Okay. You mean is it going to work? Is it not going to work? Is this a pain? Or is this something I must do? I want to do? Okay.
Right. And then the third piece is the social context. So we're looking at the different environment that you're in, like with the doctor's office, the different circumstances going along with your beliefs. So that would go along with that religious part.
But how about community, or how you view your doctor, or how you view your family, your place in the community? Is that
all
part of
works
that?
Together. Yeah.
Because I feel like that's all the things that Phranq touched on. It's fascinating. Okay.
Right. But just to sort of codify it a little bit better. And that mindset part is pretty neat. She's done some different studies. Like one had to do with it was actually an allergy study. So they had the doctor come into the room, and they had a little placard on their white coat that said fellow, showing that they were really important.
Okay.
And the whole time they're focused on the patient. They're very nurturing. They're really interested. They get the person. Mm-hmm. And then they do a little bit of an exam, and it's impeccable. They're just right. They're very competent as a doctor. Mm-hmm. But they inject the patient with histamine to get a little bit of a histamine wheel response on the arm.
Okay.
And so then, of course, you get the swelling. And then they give a cream that's actually a placebo cream. And half the time they tell the patient that this is going to calm down that allergy response. Mm-hmm. And, of course, this is what they're testing.
Sure.
What the patient thinks they're testing.
Okay.
And the other half, this cream is going to make it worse. Yeah, we have to do this as part of the study, but it's going to aggravate the condition.
Okay.
And so in general, that placebo cream actually did what they claimed it was going to do.
Better,
either made it better for the people or make it worse.
So there's no neutrality. It did something.
Right. So then they had a different group of patients come in, and the same doctor on her white coat had a placard that said student doctor.
Fascinating.
And she spent the whole time typing on her laptop, not paying attention to the patient. Went and did the blood pressure and stumbled with the cuff, showing that she wasn't really competent, but it was the same doctor.
Okay.
And so did the same histamine injection, did the same thing with telling them that half the patients that the cream was going to make it better. The other half, it was going to aggravate the rash. And the cream made no difference.
What?
Yes.
I can't get my mind around any of this.
Yeah. So it had everything
with the practitioner.
Right. Everything to do with the practitioner and the mindset of the patient that, that how
the practitioner, not the process,
right,
or the cream or the disease.
Right. It was all about the practitioner that they got the patient and understood what was going on with them and who they were, but then they were also competent. And that mindset has to do with part of the placebo effect.
That's mind-blowing.
Oh, yeah, no, it's so much about the practitioner. Two quick points. I promise I won't make another rant on that one. But the first is, as far as about the cream, one of the other reasons I became a naturopath, I missed one of them, was when I was all set to become in regular medical school, I was in the weed out class at Penn State. It was the medical physiology class. It was it was the killer class. And they had a guest speaker who they warned us was a little bit out there. And his name is Dr. Hallis. Some of you guys, Dr. Hallis. He's became famous since then. I didn't know. He was a younger physiology. He came in with a purple shirt and his chest hairs and a bunch of necklaces. It was great. But it was definitely not the standard. And he talked about the first ever mind-body type of components in a medical physiology class. It was, consider you're not allowed to talk about it. He talked about how you could take a pencil with a pencil eraser, and if someone's hypnotized, and you could put the pencil, tell them it's a lit cigarette, and put it on their skin, and it will welt up as if it's burning.
Wow.
Right? And when he said that, and I looked into that, it was true. That was one of the moments, hearing that from someone that was already in the medical field, acknowledging that was very powerful. So how you present, like we're saying. And the other is about that's a great, Ted. I think I've heard something about that. That shows you how tough it is, also an uphill battle, why it's a practice when you're a medical student, when you're a new doctor, because when you're still fumbling with things, it's hard to do that. When I was a young, new doctor, I was getting into prostate cancer. And I remember there was a couple that came in and they had heard I was into prostate cancer. I trained with some guys that trained at the Mayo, and they sat down with me. They were there about 10, 15 minutes. I was getting into what eventually has become my whole spiel now. I started talking, and they stopped me politely, and they said, "No offense, you seem like a really great, enthusiastic doctor, but how long have you been doing this?" Because it wasn't gray yet. And they said, "I think we have to find another doctor." They were very nice about it. When you're dealing with cancer and you go in, you see a 30-year-old young Doogie Howser kind of guy. Ted's had this problem. Dr. Suzelis, he still looks like he's 25, that guy, his whole life.
Hey, so I've just recently been able to have all my patients not ask if I'm old enough to be a doctor.
Yeah, you've always had that problem. But seriously, Ted might have actually had that problem.
It
because
took me
he's
turning
always had such a
50 for
baby
that to
face, a
happen.
young guy. He's like Dick Clark of medicine. And so, and then probably does add in rather than the wisdom. But the other thing I run into, the other thing is I go by the name Phranq, spelled F-R-A-N-K, my parents. But when I was around 3-4 years old, I won't go into the story, but they changed my name to Phranq, which many of you are looking at if you're on the video, for Phranq. And I know I don't need a rapper name or anything, but it's a little quirky. That's what it is. But many times patients will find me. They hear about my reputation now, and they hear supposedly I'm half decent out there. Then they fly in to see me, and then I walk out, this quirky guy with my cowboy boots and my hair, whatever, and they say, "Well, where's the doctor?" Many times they're expecting an Asian doctor based off of my name. They think I'm Vietnamese or something. And the cliche of the real famous Asian smart doctor, and then they get me. So I've had to learn to work through those expectations and understand just what Ted's saying. If they don't have confidence in what they're seeing or feeling, or if they sense any sense of insecurity in you as the doctor, you're going to lose it immediately. Yeah, so I've definitely run into that.
Yeah, another really interesting study that this Alia Crum did is called Mind Over Milkshakes. And so she had a study giving patients this milkshake. And it was a 380 calorie milkshake, but first she was giving it to the group of patients, and it had a different label on it. And it was listed as an indulgent or decadent milkshake. And it actually listed it that it had 620 calories, not 380. And so they did blood draws for the hormone ghrelin. So that goes along with your hunger. And the higher the ghrelin is, the more hungry you are.
Okay.
And so they did a set of 3 blood draws. The first blood draw was the baseline. The second blood draw was after they had looked at the label and they're sort of anticipating getting to have this milkshake. And then the third blood draw was 30 minutes after they drank this decadent milkshake. And what they found was that the ghrelin hormone actually dropped with this group. But interestingly enough, a week later, they had the same people come in, but they were getting a different milkshake. It was the same milkshake, but this milkshake was labeled a sensible diet milkshake that had 140 calories. So it was something that, you know, people looked at as healthy and not as going to quench your hunger as much. And so they did the same 3 blood draws, but after they had the milkshake, their ghrelin didn't drop. So it's the same patients.
Wow.
But because they knew or they thought that they were getting a decadent milkshake,
their body responded like it. It's a very satisfied chemically. It responded chemically.
Yes.
That it's very satisfied.
Yeah.
Well,
let me echo.
Why do we need Ozempic then?
Yeah.
Wow.
Yeah.
Let me piggyback on that one. Dr. Farmer. So audience, I apologize. I'm name dropping, but Dr. Suzelis and I go way back. I can't help it. I'm like,
all of our professors.
She was one of our professors. Oh, she kept me disciplined. She had tough love with me. But she talked about, like, when you work at some of the drug clinics, people have drug addictions, a similar thing. You can give them a placebo and they'll get high off of something that they think actually is the drug. Right. They've also shown that, like, with alcohol, like with not just alcoholics, anyone, if someone's looking for the alcohol, that when they haven't had their stimulus for a while, the alcohol, and they need their fix, they've timed it where they'll give the drink, the shot, and they will start to act buzzed before theoretically or physiologically even the alcohol can make it to their brain.
Yeah.
So it's like they're already conditioned to just go into that high or whatever it might be. So it's just like what you're saying.
Yeah, there's other animal studies where they were looking at morphine, injecting mice for their pain tolerance. And they'd be injecting the mice with the morphine and putting in this pain stimulus, and then eventually injecting them with saline. But because an injection is such an invasive therapy, their body acted like it was still morphine, and they had the same pain tolerance.
Wow.
Yeah, it kind of gets into a little bit, I mean, too tangential, but the idea of the power of the frontal lobe, the one thing that makes us different from all animals. There was a famous book, for any of you interested, we learned this in school too. It's called, name of the book is called, Why Do Zebras Not Get Stomach Ulcers? Yep. Do you remember that book?
I don't.
There was actually,
I thought you told me about that book.
Yeah.
Oh.
You heard about that, Mary?
Yeah.
You've heard that book? Yeah. So the whole point was based off of this observation from a doctor who said he was watching National Geographic with his kids, and he was just noticing how you're just watching the watering hole in the African savannah, and all these animals are all gazelles and zebras. They're all sitting around just drinking. And then a lion comes and all of a sudden starts chasing them, and they're all scattering, and lion grabs one of the zebras and eating them. He's mauling the zebra. It was someone's mom or sister or whatever. And then as he's mauling the zebra, all the other zebras go back to the watering hole and they're just drinking like nothing happened.
All right.
You know, it's like their sister's right over there. It's like, that's how animals often are. You see where, unfortunately, like, I don't know, a quail. We have quails here, and they got all the mama quail, all the little quails, and they will do everything to defend their children, little baby quails. But once one is dead and they know it's dead, it's like it doesn't exist. It just turns off, and it's like a rock, and it moves on. So that's why animals don't get the ulcers, because they're able to sympathetic, parasympathetic, up and down. It's turned off and on. and you flood the body with cortisol and stimulus to outrun the tiger, and assuming you survive it, then your body can deal with that cortisol response and the inflammation in the arteries and everything, temporarily go back. But when you have a frontal lobe and it's going on every day, drip, you're stuck in traffic, you're yelling at people, you're worried about the IRS, you're watching the damn news, you're doing this, doing that, whatever, your divorce attorney, all of this, it starts to build up, and this cortisol, and then you get the ulcers and the like. So it shows the power of suggestion and what's constantly in the back of our mind, kind of running the rest of the body. So that, at the end of the day, that is where the placebo is all coming from, because it doesn't work on animals. I mean, unless I'm wrong, have they ever done placebo experiments with animals in any way? I mean, that would be an interesting question. My research, I've not found that. I mean, power of suggestion. You can train animals and expect different responses, but I don't know how much that's placebo, right?
Yeah, and that's
so
the other thing too.
Level.
It goes along with conditioning, and that's part of that placebo response too, that people will react to a medication because they are conditioned. They think it's going to help. So it's like Pavlov's dog. You ring the bell, they start salivating because,
So that is conditioning.
Yeah. Yeah. And so I wonder also, as I started thinking about that in this placebo thing and how we can use the placebo for our patients, I thought, well, can we do the opposite of that? Could we use a conditioning of patients so that when you ring a buzzer or ring a bell or something, all of a sudden they're not hungry anymore. You get to eat some, and then all of a sudden they're not hungry.
See, I took it to a place where I would try to train, especially my patients that had depression and anxiety, because so much of that, it's so controversial, antidepressants, because of the strong placebo response, is to really train them to the opening of the bottle of the prescriptions should be a spiritual experience. It should be like a ceremony. It should be, that ceremony is not the right idea, a ritual.
Yeah.
That they are filled with gratitude, that they have this amazing medicine that this whole long line of people made possible, and that they care enough about themselves to take it, that their doctor cared enough about them to write the prescription, that I cared enough to like put positive vibes and in the pills, like that it becomes like this thing other than, oh, I'm just taking pills.
Right.
Yeah.
And it goes with what we were saying too about with that study about the doctor who starts fumbling and they feel that you're new. I ran into another issue. I'm curious what you guys think, because there's no real right or wrong to this, but the quality of a visit, how do patients interpret it? For instance, when I was a new doc, I didn't have a lot of patients. So, but also as naturopaths, we like to spend time with patients. I had this gentleman come in. He was this rich guy from Scottsdale, and I worked with him for about an hour and a half. Usually it's like an hour visit. I spent like another hour and a half or whatever. And he went golfing with one of his fancy golf buddies. They take their private jet to go to golf courses.
Nice.
And that's kind of the money that these guys have. And he was telling his buddy that he saw me and I was helping him out and all. And then then he said, oh yeah, this doctor's really good. And he spent like an hour and a half, almost 2 hours, and this and that. And then his friend said, oh, he spent 2 hours with you? He must be a new doctor with nothing else to do. In other words, because if he spent that much time with you, it's because he doesn't have any other patients. And I always remembered that, because that was the interpretation of it. You give too much of yourself, then sometimes it can be interpreted the other way. And similar, it comes down to also how much time or how you are with the patients. Like there was a doctor, like when I worked with the Mayo guys, there was a doctor, I won't mention his name, but he was a pretty well-known doc, a bit acerbic. He didn't know why I was there with the Mayo guys. He was the old guy. He used to call me the herb guy. Like, why is the herb guy here? What's he doing here? He was a real pain in the butt. He was, but patients loved him. They told me that the urologist said, we don't know why patients like him. He yells at patients. He like screams at them. Things like, you're stupid. What are you doing? Like, we'll yell at him. And I've learned also some patients do well with that, including women patients. There was same thing. There was a female patient. I know, like my wife, she just stepped out for a minute, but she's the smart one. She is Ted knows she was valedictorian. She won all the awards, and she's a very spiritual, calm person. She's the opposite of me. That's why we're together. But she, very beautiful heart. And I would think that I thought she'd have a really easy time getting started, thinking all these naturopathic women would love a doctor like her. And she's got a great practice now, but it was rough for her in the beginning. And I think it was because she gave so much. It wasn't the confidence of the doctor, like, here, we're going to do X, Y, Z. And yet some of the other naturopathic female doctors, some of them, they just had such a brash harshness to them. Almost, I don't want to say yelling at their patients, but like, pull yourself up by your bootstraps, or just, they were not the warm, get a hug from your doctor type that I thought naturopaths all were. And most of them, many of them, were some of the most successful women doctors. It's almost like you have to play into maybe what your audience is, or not audience, but your patient base. Like if you're doing fibromyalgia, for instance, there's a lot of psychological, a lot of components of that population. And to give them all that energy sometimes is the last thing that they need. They sometimes need a tough person to, I don't know, you find whoever you are, but then it gets to, is a patient going to respond to a doctor that's rude? And if they're top of their game and they only spend 20 minutes with you, we'll say not instead of 5-minute insurance visit, but if they don't spend that much time and they're a bit rude and they charge a lot of money, right? That's the thing. Do patients feel that they're getting better value? And we all know how that is. You have and we all know you have the same item, you charge twice as much. People think they have more value for the same thing. And that's a quandary for a lot of naturopaths, because we tend to be a lot of self-pours we get in trouble for, that we don't charge what we should, because there's a lot of empathy to try to help people out. But how much do we undermine our treatments for making it?
You do. And I think that's the difference between empathy and understanding human psychology. Right? People want to know that they're getting value for their money, and and price is a signaler. So it's interesting how you could get that wrong and then not do as well for the patient. If the relationship is part of the placebo response and you want to capitalize on that as well as the actual medicine that you're giving, that's fascinating, actually.
Yeah, I also found that with talking about that doctor that's a little bit harsh and everything, it all is also about their presentation too, because I've seen some naturopathic doctors that tend to be very condescending to their patients in order to look smart themselves. Everything that they're doing, oh, well, that's not right.
But condescension is different than confidence, right?
Yes.
Right. Like you can be confident and right and not be condescending.
Right. Yes.
And I think that's hard. I think that really is an interesting point, because it goes, if you're truly confident, there's no need for condescension. Right. Because you don't have to talk anyone into. No. You own it.
Yes.
You don't have to talk anyone into your authority.
Yeah. But it's a fine line about that mindset where you have one doctor that acts pretty much similar, but one's being condescending because they're trying to make themselves look better, and the other one that's just saying it how it is because
they own it.
They own it and they know that they're right.
So then it would be like you have to know your own temperament.
Right.
Right. Like, because I can see if Phranq tried to be like really calm and soothing, I would pick up the dissonance. Like that doesn't feel right to me. That there's something about this guy that's not, I don't trust it then. And if you were to act like Phranq and start doing all these things, I'd be like, okay, you're overcompensating for something because you're not owning who you are.
Right.
And I think that is just so interesting how much that puts me as a patient at ease if I know you're comfortable just with you as a human, not even as a naturopath, but are you cool with you as a human? And then as the human that is also the naturopath, which I've hired to make me well.
Yeah, that's also why I think I've had trouble in the past working with the placebo effect, because I'm not that person that's going to be that domineering person that's going to say, you're going to get better because of this. Yeah. That I know that if I do too much, it's going to look, and it's finding that right balance so that they understand that I know what I'm doing, I'm confident, but I'm caring, but I'm not.
That is just so interesting to me because Phranq is very comfortable with it. I'm very comfortable with it, but we have similar personalities. Theatrics. I like theatrics at work. I used to say I'm doing a performance at the drive-through window. Like, I'm performing for this person so that I can capitalize on the placebo response, but I'm comfortable with that. And you're not.
Right.
So I think that's so interesting. And especially because you want to capitalize on it because you care about these people and you're realizing that there's some power there.
Yeah.
And how do you harness that coming from you, being you? I love that. Yeah.
Yeah. So it's definitely just a bit of a different way to do that.
Yeah. Yeah.
So that goes back again to, I think it was Dr. Messer. We're going to do the whole school by the end here, Ted, who talked about, and we'll get back to him or homeopathy a little bit. That's the ultimate placebo.
We don't talk about homeopathy on this show, Phranq. That's the one thing we don't do.
Well, fun one, but it's a really fine. It's a fascinating. Wait, we get to that in a second. But when I talk about as far as about being yourself, when I graduated, I ran into the same trap some of us. There was doctors that I looked up to, and it's not that I wanted to be a mini me, but you look at a certain, okay, these are professors, or there are certain doctors, like many of the homeo nerds we used to call it in school, which I was not one of them, but they all idolized Dr. Messer, for instance. And Dr. Messer was head homeopath that came to our school and kind of redid the whole homeopathy program. So if you're really into homeopathy, he was the guy, and he had a whole bunch of his whole little thing, and people loved him, that group. But there was different, I don't say cliques, but different groups. Anyway, there were certain doctors I looked up to. Some of them, they looked up Dr. Messer and others. And one of the things is you leave school and you're trying to find yourself. You're still trying to find your bearings. You're trying to get your balance and about just what is your practice going to be? What are you good at? Yeah, there's so much. The first few years really are rocky. And extra rocky, I may add, if you're not married to someone who's got a nice paycheck and benefits from a corporation. Right. Just saying, if you're single or if your other better half is also a doctor and $150,000 in debt, that's not a bad situation. But I digress. But the thing is you have to be comfortable with it. And it's a big deal because if you're not financially comfortable and you have stresses of trying to pay off the debts and trying to figure out where you're at, that does change a doctor about how they practice, about how much they might start to push supplements or different treatments that maybe you don't need. Not that they're trying to be unethical. They can't even, they need gas to get home. And you're an ethical doctor, but you're caught in this boat, this problem. So a lot of this plays in. But even at that point, how do you find yourself? I come from Philly originally. I come from my family. They were their steel subcontractors. And they all wore Italian suits and this and that, and nice shoes. And I became a doc. And when I was practicing, I wore a suit and a tie and nice shoes and I don't mind getting dressed up. But A, I'm in Arizona. People wear cowboy boots. And number two is that people are often trying to get away from the conventional system. And that was one thing I realized was, what am I reflecting? What am I saying? Am I being part of the system with a tie, which I used to call a stranglecloth of society when I was a rebellious teenager? But what does that mean, part of the system? I'm nothing against dressing up. The diehard naturopaths, they used to wear sandals and granola gear. I mean, so what are we doing? The other thing was, and this is very true, this is what Dr. I think Messer or Cruzel had mentioned, is you have to be yourself.
Right.
And that's the hardest part for doctors because you're still trying to figure yourself out. But don't try to be like the doctors that you look up to because you're never going to be them. You can take certain points from them, but you don't really click into the groove of your practice, both technically, but also of everything coming together until you just meet who you are. And it was hard for me in the beginning too, because I didn't want to let loose who I am half the time, especially cash paying, these guys coming in. I'm looking up as these CEOs and such who I see in my office. They really want me being me. So I was always putting the barriers on, and I did well, but I started finding the more comfortable I got in my technical side, that I knew my stuff with prostate because I just do it all day. It began to feed on each other. And then you do what these mentors said. You begin to, therefore, when you find out who you are, you don't have to market. Right. Because you will attract who you are. Good or bad, you will attract who you are. To give you an example, and I already said before, I'm no fan of the government. So I'm very libertarian in my views. Arizona's a very libertine state. Ted knows the deal on that with me. So I don't advertise. I don't have the Constitution on my door. Although Jonathan Wright, I actually worked in his office for years ago. He let me practice in his office when I would sometimes see patients up there in Seattle. And I'm in his office. And first off, you walk up and there's a whole thing of the Constitution sitting outside of his door, right? And then you go in and he's got T-shirts saying, I got busted by the ATF and all I got was this lousy T-shirt. And he's got him up there. And he has things of Thomas Jefferson and everything in there. Now, he was busted by the feds a few times way back in the day as a Harvard MD because he was the first one to promote vitamin C IVs that almost everybody does now. He was the one using his Harvard MD to give credibility to something that the system said no. Now, how does this, again, come down to placebo and everything? Well, he tends to get patients who are similar mindset. When he's advertising, you say, look, just so you know, this is what I did for you and this, and so he gets troublemakers. And I found that I get troublemakers. All right. I get the guys that are similar mindset. And the proof was in the pudding in a way. So let's get one, let's hit another untouchable, because that's how I am. Let's talk about COVID and our friend Dr. Fauci and the vaccine and all that. Let me do this quickly. Is that apparently without the world, but we'll just use America, that 80% of Americans got vaxxed or pseudo-vaxxed or whatever. They got vaxxed. 20% did not, right? So it was interesting as we started looking. So if you're in a hospital, a regular MD, it's usually 80-20. If you look at naturopaths, it tends to be, it's about 70% got vaxxed and 30% didn't. Right. So it's a little bit less. More.
I thought
a little bit less got vaxxed. Yeah. But it depends on the practice. It depends on the practice. So then some of the doctors that I see, depending on like if it's an all female, like doctors, all female patients, they tend to be more the 70-30 of naturopaths. The ones that had more male, they tend to be more like 50-50 that maybe were vaxxed. Now, in my office, I mean, granted, it could be different for you guys. I wait till I hear what your experience was. But in my office, it's less than 10% were vaxxed. It was like probably 5%. And I do ask each patient, I've been doing this before even the vax came out, they got COVID, just because COVID does have an effect on PSA levels, which allows me to look at prostate and all this. Right. So it's been this whole journey we've all dealt with. But it was interesting that I didn't have any experience with the vax with my patients because none of them got vaxxed. And I started to understand why, because the guys that I see are already anti-establishment troublemakers. In other words, if they already believed the system, they would have had a biopsy already. Yeah. They're already like, all right, no, I'm not doing it. You're telling me to get a biopsy. Well, let me get a second opinion. I'm going to talk to this quack naturopath, Phranq, talk to him and see what he has to say. So they're already questioning it. So when you have the experimental drug, blah, blah, blah. So you attract, in a way, as I said, who you are. And I didn't expect that at first, but they were right. So do you get patients reflecting you in different ways?
Yes,
Ted?
I want to know this. I want to know what your patients,
anything?
how you would characterize your patients, because I spent a lot of time interviewing them when we were doing your media and everything. I think I kind of know who they are.
Yeah. I mean, a lot of them do have a lot of similar values, obviously, but but here in Ohio, since there aren't a lot of naturopathic doctors and it's not the norm,
like it is.
Yeah. So people are definitely a lot more of those renegades that are coming to the naturopathic doctor regardless. So,
but they're not the in-your-face renegades.
No.
I feel like yours are a quiet renegade.
Right.
Kind of like you. Like they're a little bit, they're anti-establishment, but they're not shouting it from the rooftops.
Right.
They're just like, I don't like this, and they go on with their lives.
Yeah.
Like,
yeah, but you still have to have a sort of a bit of that when you're going to see an unlicensed naturopathic doctor in the state.
Oh, that's true. An act of rebellion in and of itself.
Right, right.
Also, a little bit with the COVID, it's interesting how COVID has now become, for many patients, a new weed out. I find that patients will show up, but you guys, and usually when they're starting to invest into you as a doctor, if you don't ask in some ways, because they'll ask you, they'll say, so doc, what was your opinion on it? They want to know what your view is because they're already putting you in a box one way or the other. And I know a lot of patients, they left the naturopaths, for instance, they saw for a long time over this issue, as contentious as it is, because it says a lot about the mindset of the doctor that you are now investing in. And remember, it's not just money, which it is, it's now the placebo, in a sense. It's letting yourself loose into the open arms of this doctor. Will he fight for me and have a different view?
So you mean they literally ask you if you've personally had the vaccine, or they are asking your beliefs about it?
Oh, they'll ask my beliefs. Yeah, they'll ask about the vaccine, and also, and I'm going to get back to the vaccine in a second, but also before the vax became a thing, marijuana. Yeah. It was a big deal. Remember, here in Arizona, we already legalized it, but that was a big deal. They would come in and they'd have this whole visit, and then sometimes towards the end, they would try and feel you out. And I'm kind of the strange guy. I'm an interesting cat. So they already know I'm a little different guy. So they would open up and say, hey, I don't want my wife to hear, but like, what do you think? Do you know anything about that marijuana stuff? Like, your CBD, you know anything about that? They would usually drop that at the end. And they would, and many times they would just feel embarrassed. They didn't know how to broach the subject. So what I would start to do is, I have a book called The Little Blue Book of Marijuana. It was like, I got it from a marijuana conference for doctors. And it's a little thing. And I put it in a very specific area in the office. So the patients, after an hour or so, they'd start looking around and they'll notice the book. So I know they start looking at their wife. Oh, he's got that book there. And they feel safe to now bring up the question if they have questions about marijuana or CBD. And the same thing sometimes with COVID. Because they eventually, a lot of times they'll ask. Now I ask because
you need to know that for clinical.
I don't care if it's vaccine, I just need to know. But then they want to, clinical. But then they always want to counter to ask my opinion. And I realize that for a lot of them, especially the wives, because a lot of times the wives are the ones that they're in charge. Trust me, they're usually the boss a lot of times in my office. So they really will push you on it. And if they do, and I know that I can tell that's going to be a line where if I answer the wrong way for them, whatever it is, then it may not go forward at taking on their husband for the next 2-3 years, tracking them for a prostate cancer, that they have to have this trust of it. And I know that. And look, I'm booked out months. I don't need the patient necessarily.
So you're cool with that.
Patient. I want the right people for me. So if they push me on it, if they push me on it, I'll just tell you what I say. I'm just be upfront. This is what I say in my office. Because I know they were looking for, I say, look, oh yeah, because they start hinting, and I say, well, look, I said, just so you know, I do love Dr. Fauci. I have a real big respect for Dr. Fauci. I said, I have a statue and a velvet Elvis. Remember the velvet Elvis thing? I have a velvet Fauci at my house. I said, and then my wife and I, we light candles every day, and I light them, and we bow down to Fauci every day because I love him. Because no one has done more for my profession than Dr. Fauci, right? So I owe a lot to him and a lot of our business, because if you didn't question things before, anyway, that's a loaded topic. But the thing is, once I say that, the patients, and I don't want to get into the whole thing with COVID with my patients either, unless it becomes a thing. But I realize of late, that's becoming, I don't say a deal breaker, but when we're getting back to placebo about, can they feel open to start allowing themselves to be healed with you, right? They have to have that bond, just like I said, looking at the patient, bonding. And now, because we're so culturally separating and different things, it's a problem. And I'll be honest, I don't know a quick and easy answer to this. I bring this up to my students. I say, look, the last thing ever you want to bring up is politics in an office, right? The last thing, I mean, for any job, right? You don't want to bring it up. I mean, it's unprofessional, unbecoming. But what do you do in today's world, in a sense? I don't know. My rule has been, don't bring it up. But what do you do when the government, with Obamacare, not to get at all that, but they got involved in our world? I don't know
how you cannot bring it up.
When the government's getting involved in our world, I'm trying to not talk about it. Right now, because it affects the whole reason they're seeing you a lot of times is the ramifications of it. So that already starts this. So since that, they brought that up, and now we see through 20. By the way, I'm not into the political thing, but it was interesting. I watched some old videos from around 2010 where there was a division over the judicial nominee rule that the Senate changed. It's all technical stuff, but it was funny. I saw this old video on PBS where the Democrat and Republican are both sitting next to each other answering questions for the host. And my family and I were watching. I go, wow, this just seems so ancient to see a Democrat Republican senator together, just like they're different. They're talking, and they don't see it now. But but they both said that the division, that there's always been differences, but this hard division in Congress, that the fork in the road that just keeps going till we see, how the world is today was that Obamacare vote, that it kind of put it was like the first real fissure that just split in a deeper way.
Yeah.
And it's been going ever since. So it's interesting. It's about our realm of healthcare, that the real split in Congress that's gone. So now here it is, how many years later, and the money issues and this, and then the whole vaccine thing. And so it's splitting so much that patients now, doctors are political in a sense. And then what they saw with the vaccine deal, and then doctors that got fired and all of this, or their doctors weren't allowed to talk to them about things, or, you know, it's obviously, that's a whole other conversation. But when patients know this now, is the doctor really answering for me or to the system? Who are they answering for? And once the doctor realizes, or I'm sorry, once the patient feels that you are not answering for them, but who's signing the check, or the government or some whatever, then the entire house of cards goes of credibility, just like in many areas. But when it happens with their doctor or the healthcare system, they don't know where to turn. And it's tricky for these guys, especially older guys who I see all day. Now I don't know if Ted's still a baby here, but I don't know about Mary. No offense, you and I are kind of older, but my patients, I say, look, they grew up with Marcus Welby. Remember Marcus Welby? No? If not Mary. Okay, well, it's okay. Marcus Welby was an older show, came out like in the 60s and early 70s. It was a famous show like the Brady Bunch or something, but it was a lot of the audience knows Marcus Welby. My grandparents used to watch it. It was about a family doctor. It was a good, like, Little House on the Prairie doctor show. And when I say it to my patients, they always love it. They laugh because they all watch Marcus Welby, the good old fashioned home doctor. Well, what's happened to that now? Now all of a sudden they're in this new medical system, and it's so different. Whereas younger people, they think this is normal.
Oh,
they've
intended.
been indoctrinated into it, pun intended. So they don't see the contrast as much. So anyway, so that's kind of where, as far as placebo, this world today, you don't want to be putting stuff on your site. Hopefully we don't get to that point, but I don't know. I let patients bring it up if they want, if they have questions. I try not to get bogged down into it, but where I used to never bring it up, I say, I'm not going to go there. But I'm realizing, especially if you're taking on this relationship of a high liability case, where if we're talking about whether you have surgery or not, or mortality issues, we have to have that kind of trust. And I've changed a little bit, and it's still a line that I'm not sure about because of the way things are. Yeah.
Mary and I were talking before the show and talking about this whole mindset thing. And that same researcher, Alia Crum, was talking about mindset and health and how that can make a difference in your health outcomes. And so that made me think of COVID. And I always felt like, especially in that early time in COVID, that there was so much fear for so many people. That mindset was part of why they had such bad outcomes. And the people where they didn't feel as threatened, they had better outcomes with COVID.
Yeah, I don't know if I saw it directly, but that doesn't surprise me at all. And then you wonder, it's a lot of it comes down to self-empowerment. And it's that you're in control again. If you're in control of your own healthcare. And so if you feel that you're empowered, that I can beat this, that I can control this, when you feel that, you're not empowered. And everything's closing in, and it runs in fear. I do another podcast that's a little different than this, and my co-host, he's louder and longer than me, if you can imagine. But he starts off the show with, we have like rock music starts, they're doing a whole bumper music, all that, and he goes, no fear, no fear, fear, no fear. The point is, fear is the driving force of everything, and manipulation and how we're controlled and all this, but also in medicine, it comes down to fear. Like when I talk about the vaccine or the COVID issue, I tell patients, look, I'm not here to judge you in one way, whatever you're going to do, because it comes down to fear. What do you fear more? Do you fear that this unknown virus that was made in a bioweapon lab, I'm sorry, a bunch of bats, but in a bioweapon lab designed by people, it's gene splicers, and it's unleashed in the world, we know nothing about it, and no one's researched, we have no idea. Is that what you're afraid of more than the vaccine? Then you take the vaccine. Or are you more afraid of the experimental drug made against the experimental, we know nothing about virus? And there's a lot packed in each of them, but it's simply which are you more feared about? So it always is fear that drives things. It's managing the fear, which is ultimately one of the the duties of the physician. And that's really what a lot of this we're talking about. It's the comfort level, the security, the confidence, the white coat, whatever it is, everything, all this put together. It's reducing the fear,
right?
Because the more comfortable they feel with you, then the fear goes away. And whatever the outcomes are, I tell my patients, I said, look, we're going to try to have you live to your 200 and all this. We get that. And we do our best. But my promise to them is, even if things don't turn out the way that we want,
control,
is that it'll be on your decision, that you will look at all the options, and whatever it is, you will know. You'll be able to, my job is, after you listen to me yap for how many hours in class time and visits, is that I want you to be able to look in the mirror and explain to yourself why you're not having a biopsy, or you are going to have a biopsy, or you're picking an MRI focal fusion biopsy, or that I'm doing this, that you can explain to yourself and your wife, and maybe even the urologist that's arguing with you, and your kids are screaming at you, hey, Dad, stop being stupid and get the biopsy or whatever. You need to be able to say it to yourself, not just some doctor telling you. When you're at that point, then it doesn't matter what else happens. You'll be confident with it. And even if you get bad results, you won't live in anger. One last point on this. I remember a lot of guys, they will have like prostate surgery. And the number one problem with prostate, it's called a radical prostatectomy, is they will lose their erections. That's kind of what a lot of this is all about. And sometimes a guy will have a surgery and they'll only lose 5 or 10% of functionality post-operative. Now that's considered like a win. That's a home run. 5%, 10%, from back to baseline. That's amazing. I mean, I would say close to half the guys used to lose 100% of all functionality. But there would be some guys who lose only 10%. But they were not told by the doctor that could happen. They were not told. They were just, PSA's over 4, get a biopsy. Oh, you got cancer. We'll rip it out next Tuesday. Just talk to the nurse on the way out and sign on the bottom line, and we'll take care of it. And then all of a sudden, when the dust settles and they finally pull the catheter out, they're having softer erections or something, and they're angry because the doctor never even told them about it. And then they go on these websites and chat groups, and they create the forums, and the urologists, I can't stand them, and war on doctors, and never get a PSA. And I have to battle those guys on the other side. Whereas if a person went through the process and they finally chose that procedure after looking at everything, balancing it out, looking at the green, yellow, red risk factors and talking to their wife and all of this, and they get full, complete erectile dysfunction, they don't have the rage and the anger the rest of their life, simply because they knew all the options going in. I know it's kind of self-evident to you guys. I'm sorry if I'm drawing that out a bit, but I see that quite often, and I realize it's not even about the outcome as much as the empowerment of what they knew going into it. And the fact that the system says, shut the hell up and sit down, and this is what the app says, and HAL 9000 and whatever else, and that's what you're going to do. Once you take away the sense of empowerment, then again, the placebo's a nothing. It's not even there. There's nothing to hold that case together. So it's interesting, before homeopathy, is when I was a new medical student the first year, many of us were talking about placebo in our class. And I found it interesting how much we're talking about placebo and harnessing placebo. I've always stuck by that. I've always, as you can see, it's kind of a passion of mine a bit. But I found something interesting, Ted, is that some of my friends, we won't mention certain names here, but some of my friends they agreed placebo. But then the second year, they started learning about acupuncture, for instance. And then by the third year, or homeopathy, and then by the third year, then they started to invest in, let's say, the homeopathy. Was it Radar, I think was the one? And it was, you remember those homeopathy programs? Or, right? And there was Radar versus another program, and which one costs more? And one of them only ran on Macintosh. So some of the kids had to actually buy a Macintosh. I'm sure Ted would have hated that. Had to actually buy a Macintosh in order to run the program on it, right? Which is like $1,000 homeopathy program on a $1,000 laptop. And in order to have the right setup. And then if you had the other computer program, well, then it was like Coke versus Pepsi over which one was the better program. And the same thing with acupuncture. There's this style of acupuncture versus that style. There would be different programs that you paid money for, the databases and all of this. And then you'd spend all of your time in acupuncture till like 1 a.m. studying your exams to make sure that you got it in the exact point of the ear. And you'd spend hours making sure, is it over this part of the lobe or that part? Oh, you did it wrong. It's got to be over here. Every minutia to make sure it was in the right place and this here and that there, because the other book has it a little bit off this way, but you're doing the proper style. It's like my Kung Fu versus karate and Bruce Lee and all of that. And then by the 4th year, if you happen to say, wow, we're good naturopaths, mind, body, and spirit, we harness the placebo, like what we probably placebo in acupuncture and homeopathy. And these same friends, and they're still my buddies, who started off as placebo is so powerful, after you've invested years of your life and you've gone into debt and you've been up till 2 a.m. studying all the nuances and you paid for a program and you've done all of that, then by the last year, placebo, are you offended me? Isn't it placebo? It's because this program was better than that program and this and that, and all of a sudden becomes the Kung Fu, right?
Right.
And I found that a fascinating metamorphosis over time, that it stops becoming placebo because you have ownership in the methodology. And then the question, is that what it takes to be a good doctor, is to now not even think of placebo or the mind game. I hate to call it a game, that component. Instead, it's all about the procedure and technical. But then the minute you do that, you turn into the allopath, which it's about the technique. It's the technicals. As I often say, are you a physician or a technician? Which one are you? Surgeons have become the technicians often. In many ways, we can get so bogged down in the methodology and food fights. And Ted, I'm talking about in our profession, there's this and that. I'm sure you, Mary, and there's different things. So taking that and applying it to homeopathy. So this, be real clear, I'm not beating up on homeopathy at all. I'm really not.
Because I might not have mentioned, we don't talk about homeopathy on the show.
Okay. Well, this is an example of homeopathy because I don't really bring it up either. I'm just saying my wife is, she came from the homeo nerd group. So that's all cool. And some naturopaths are really into it. But when we talk about placebo, and I've brought this up in my placebo conversations, there is nothing better aside from the drug companies, but equal to them is homeopathy. Because homeopathy at its core, I believe, is, with all due respect to practitioners, and I'm not taking away from them at all, it's the world's greatest placebo experiment. It's homeopathy. Because at the end of the day, it's a sugar pill, right? And it has every component. It has every component of
So I have
placebo.
to leave my own show? Is this where we're going?
No, I'm not putting it down. No, I'm not putting it down. I'm just saying. And so when I talk about that, and it has all the components of the ceremony and everything that you do, and it's all together, including the different numbers. Oh, this is not 10x, it's 3M, and it's more powerful. Oh, we got the next one up. It has every component of placebo. And yet, again, to me, it's the most beautiful thing. It's the most beautiful thing. And sometimes my diehard homeopath friends get offended by it. And I say, why are you offended? Because if you're a homeopath, either it works the way you say it does, which is fantastic and beautiful, or if it is a placebo, that's all it is, then you are the best doctor possible. Because that means your entire practice is you're healing people with their mind, without a drug. You have found a way to harness everything that we're trying to do. And yet, that's my point is when they get so into the technicals of the methodology, they suddenly find it offensive to think that it's not the fact that you're such a great doctor that you are presenting healing to such a way that they're healing with a sugar pill. Instead, it's like, oh no, it's not that. It's the fact that it's the right brand and they did it the right way and it's all the technical. And that's
because
fine.
they think that you're calling them a fraud.
Excuse me?
Because they think you're calling them a fraud.
No, exactly. And it's not that at all.
I think it's just not understanding the fundamentals of homeopathy.
And that's fine. At the end of the day, to me, I look at the free market, which is if patients are paying you money and you still have a house and a car and paying your debts and all this, and people love you and they're getting helped, I don't give a what about what it is. I'm just saying either way, it's a fantastic approach. And I find personally that homeopaths, I think, are the ultimate best physicians on the planet, in my opinion. And I've said this constantly, so I don't know your background with it, but if you are a focus in homeopathy, that to me is the ultimate compliment that you're able to get people well. One last point, there was a psychiatrist who, this is a little bit tangential again, but there was a psychiatrist in New York, and he died, I don't know, back in the 40s or something. And he had this practice where supposedly he got all these people well. I think it was a psychiatrist, I think. And he was like the top psychiatrist or whatever his profession in Manhattan. And he supposedly he only gave it they wanted to know what medicines he was giving. And when he died, I guess his wife allowed all the doctor friends to get in to find out. And it turns out it was all the same medicine, and it was like a placebo that he was giving all those years, and knowingly. Which now this is before the ethics part, which is maybe the last thing we should talk about at the end, is the ethics in practicing with this. But the fact that you had all these psychiatrists going in looking for what is the magic drug, and it turns out for like 30 years he was giving everyone placebo, but he knew what he was doing and he was harnessing it. Is he a fraud, or is he the ultimate healer? I mean, he's achieved what we ultimately spent all this money trying to find technical ways to do it, and yet you can do it as a healer, forgetting the degrees and the tests. And some people just are healers. Some people it's innate. That's why I don't care about a degree. Some people have degrees, they make bad doctors. Others don't have degrees, and they're the best healers. So, like I said, it's just like what happened in school. You get so into the technicals. Hopefully we don't lose sight, though, of the power of what we're bringing to it. And this is for acupuncture. It's for my own practice, like I said. But anyway, go ahead and I'll shut up. I hope Mary's still there. You didn't walk out on me. I hope I didn't get you upset. But go ahead.
Yeah, she's still here.
I love Mary. Hello.
So I want to go on a totally different tangent with this, because as doing some of my research, I found a lecture about basically a placebo denier.
Okay.
Somebody trying to argue that the placebo effect really isn't there.
Oh, fascinating. Based on what evidence?
Well, he was actually, and he wasn't even a doctor, but I found some studies, too, that were looking at debunking the placebo, or one was called The Myth of Placebo Response. It was in Frontiers of Psychiatry just a couple years ago. But they concluded that the placebo response is really patient-provider interactions, therapeutic rituals, and psychological and social context for the treatments.
But that is exactly the definition.
Right. But that's because the way they view a placebo is
a pill.
Just the sugar pill that it possibly can't do anything because it's just a sugar pill.
Right. So it's not understanding the topic.
Right.
Yeah.
And look, in all fairness to Mary, I will defer. My wife always tells me that if it's just placebo, it wouldn't work on animals. So there we go.
Right.
So,
but I just think so that book basically was defending, really didn't make the case at all against placebo response.
So that study, no.
So
because they were just changing the definition of what.
Right.
Okay.
This other guy that was doing the talk, his name is Mike Hall, and he was some British guy. But a lot of what he was looking at was different things like bias from the researchers, or the Hawthorne effect, where people don't they forget what's actually happening, or they forget where they were, and so they feel like subjectively they're better. So a lot of it.
So it's all subjective and not objective.
Exactly, because he was only looking at studies that had subjective measures, and the couple that he would pull up, he felt
pain is very subjective.
Exactly. Or, of course, things like depressants. There was in that same journal that I talked about last year, there was a study that came to the conclusion that 70% of the effectiveness of antidepressants is from placebo.
Right. Which I think brings to mind a point where the antidepressants, as an example, have a lot of side effects.
Right.
So why not just give then a placebo and save the people the side effects? But then we get into the ethical thing with it, right? Which I don't, But the antidepressants are very interesting when it comes to that.
Right. So, Phranq, I have another question for you. So, are you familiar at all with the thought of combination therapy where you might use a medication, but pair it with a placebo to try to enhance the effectiveness.
Oh, I like that idea.
Oh, yeah. I think I do that without thinking of it in those terms. Right. But yeah, absolutely.
Do you do that, Ted?
How do you do that?
I don't.
But will you?
I don't know that I would specifically give a placebo knowing that it's a placebo.
See, and I think it would be interesting to have in a pharmacy a whole line of placebos. And I would design them with the colors in the bottles with all these nice little words on them. And I would just sell them outright as placebos.
Right. So
this is what it is. This is a placebo.
Right. So you have the blue pills that help to sedate people.
Yes.
You have the red pill that really energizes them and wakes them up.
But I'd have to be very careful not to use medical terminology, right? And because it would be misbranding under the Board of Pharmacy. So you have to be careful with all of that.
Right. Just don't do generics because evidently brand medications have a better effectiveness than generics with the placebo.
But I think they do. And I don't think it's just placebo with the brand. You know what I think it is with the brand of medication? This is what I really think.
Okay.
And Phranq can tell me I'm wrong. But like the branded medication, let's take Prozac.
Okay.
Okay. The people that invented that, the sweat, the tears, the everything that those scientists put, the sacrifice of their family, their well-being, the discovering of something that can't be discovered, all of that went into that.
Mm-hmm.
And then the other guys just knocked it off.
Right.
I just think it's a different energy.
So the question is, this is the problem. Because if we understand placebo and hence the mind and the spirit and for the patient's benefit, well, how does that play into utility, into actually practice? I mean, obviously, we talked about the script pad and different things that we do, but you cannot, by law, give a placebo unless the patient knows about it. Right? It has to be a study where they sign off and they know that they could get a placebo in a double-blind placebo study. So you cannot give a placebo without them knowing about it, which defeats the whole damn purpose of it if you're trying to use it in your practice.
True.
Not necessarily, Phranq.
And that's the problem.
So there's a Harvard researcher, Ted Suzelis. He was an acupuncturist initially, and we actually, Phranq, we had to read his book, The Web That Has No Weaver. But
I want to read that book.
He did an open placebo study where people knew that they were getting the placebo and still had benefits.
Yeah.
Well, the thing is, because I remember talking with Dr. Runbeck, there's another blast from the past. He was on our medical board, and we had these talks about it, about placebo. And I wanted to harness the placebo. I wanted to use it, kind of like we're talking about. And oh boy, he was by the letter of the law. Oh, you can't do that. You can't. I said, what do you mean you can't? He says, well, you cannot knowingly give a placebo. So I said, you can't. So you can't knowingly give something that you know does not work the way it's supposed to, right? Which is hence by a placebo in this case. So I said, all right. Now, Mary, please don't come shoot me here. I've got nice tires on my motorcycle, so don't come after me. But yeah, but just respectfully, I'm trying to make a point here. Because if you're not allowed to knowingly give a placebo, then the question is, and this can apply to other areas. I'm just going to pick on homeopathy just because I love you. But what I mean is, the question, I said this to Dr. Runbeck. I said, well, then, in all due respect, if you believe that homeopathy works the way you think it does, then you're legally allowed. But if you believe homeopathy is a placebo, then under the law, you're not allowed to. And he says, that's an interesting point, right? So, I mean, it's a fact. So now does it come into the mindset of the doctor? Right. You know what I mean? It gets into it. Look, personally, I don't care necessarily what the government says about this kind of stuff. I took an oath to my patient. I didn't take an oath to the man, right? So I'll just get that out of the way. But it is an interesting question or a conundrum that it goes back to what I said in the beginning, which is it's almost like you have to be, and I use the word indoctrinated, but you almost have to go from the esoteric into getting yourself immersed into whatever system, technique, whatever it is, philosophy, where you become it, where you don't even think about anything else. It works the way that this supposedly is. And then in a way, the confidence that comes from you knowing that your technique is the right technique and you did it this, that confidence is therefore what you're now delivering energetically, psychologically, and other ways to the patient. Right. And once you don't believe it anymore, it doesn't work. My favorite cartoon, Roadrunner. I'm a Roadrunner guy, right? Wile E. Coyote. My favorite bit, right? The coyotes chasing the Roadrunner. They go off the Grand Canyon, and then they're like running in midair, right? And then the Roadrunners stop. They're both in midair. And he turns around and he puts a stop sign, and the coyote's going, what? And the Roadrunner hands them a book, right? And it says laws of gravity. And then the coyote pulls out some glasses and he puts up a light and he's sitting there and he's paging through and he gets to the end and he goes and he looks down. He falls. It's the best bit, right? Bit. And it says a lot about human nature. At what point, when you understand how it works, does the whole thing fall apart? I mean, I don't want to say ignorance is bliss because that sounds like we're insulting her with this concept. It's not. It's powerful. And that's the problem, this whole thing. We started off. Placebo is something to be avoided. It's something that's offensive. It's something that belongs in the vaults of the drug companies to avoid at all costs. And then even naturopaths, we get all embroiled in all the techniques, and then placebo offends us. And it's like all over. Then how do we harness it? And then the law says you can't give it.
Right.
And yet here it is, the most powerful part, mind and spirit. And we can't talk about spirit because religion offends everybody. And we can't talk about and use placebo to enhance it because all these things. So that's the bane of this problem. The witch doctors had a lot easier. So I don't know, but it's a
great...
Bring
back the witch doctors, I say.
So, I agree, Mary. But yeah, so that's kind of the thing. So any thoughts you guys have on how do you, in modern practices, we covered a few of them, but how do we incorporate that into our practices, I guess, legally and ethically? But we're spending time with our patients. You're engaged with them. I think the confidence is a huge part. Whether we charge a lot of money, that's kind of a whole other thing, whether that works or not. But what do you do, Mary?
Just the examples that I gave earlier. Yeah.
Said earlier.
The big production.
The last couple of things I'll mention before I guess I'll wind down on my end with some of this is when you're also looking at this, just random quick thoughts here is with magic. A lot of it is with magic. The art of magic is something that I bring into practice. I have a class where I talk about magic tricks and how the art of magic is something like with medicine. And it's similar, like with placebo and with magic. Magic is not just about the trick, like tell me where the mirror is, whatever. There's a lot of performance with magic. There's a lot of technique. There's a lot that leads up to it. There's a lot of psychology in magic, reading the audience, trying to figure out who is open to the gift of magic. Some people they don't really believe in magic, but they're open to the gift and they want to. And then there's others, they tend to be more men, but also some, they get offended by it. In fact, we know technically many of them are sociopaths. And I'm not saying everyone's a sociopath, but that's a whole other topic for another time. Ted, you don't realize I became an unfortunate mini expert on antisocial disorder because Savard and I encountered one a long time ago, and I read all of the books on it. I was astounded to learn about that world. But they make up 4% of the human population and brain studies, and that's a whole other thing. But one of the tells of sociopaths is they find abhorrent psychologists or anyone that tries to get into their head. So they will run away from a hypnotist, counselor, anyone that's trying to get in their head. And the same thing with magician, even though it's just entertainment, but the concept that someone's trying to, use with respect to the audience member. That's why a magician is trying to get consent that we're doing a magic trick. We're not trying to scam you. But they don't even like that. They'll run away. They'll yell. They'll spoil the trick. So you got to look out for these people. And it's the same thing sometimes in my office. I don't think I probably see too many sociopaths in my office, but they're probably not going to spend the money to come do this. But you have to look out for these kind of people about that. And also where you position yourself. You want to have the sun behind you just as you're about to do the card sleight. So the sun blinds the person quickly as you do your magic move so they don't see it. So there's a lot of kind of like orientation, and that's kind of like how you set up your room. Where do you place things in your room? Where's the eye going to go to certain things? The comfort level. I think that. So yeah, exactly. The feng shui, absolutely. So those are just some of the random things about how magic I find applies in, whether it's placebo or not. But you're trying to harness the mind in different ways. Yeah. But it was helpful learning magic.
Yeah, I learned hypnosis, and that was really helpful too. Using it for my kids when they were going to get blood drawn or go to the dentist, I would hypnotize them. I gave them placebo cough medicine, which is like hypnosis. And yeah, when you realize the power of your own mind through hypnosis, then it gave me confidence to know I could influence other people using that aspect of the placebo response, which is my relationship with my patients.
I'm sorry, do you do hypnosis yourself?
I was so freaked out by how easy it was and what I could do with it that I stopped. Like I did it in my 30s and then I didn't want to do it anymore. I was afraid of the power, Phranq.
Really? Wow. Why?
That's how I was then.
Wait, why?
I have grown. I probably would be fine with it now, but I use other modalities to influence people.
I would love to learn about that. It's a shame we didn't have hypnosis class in naturopathic school. And I gave you my long bio in the beginning. I'm sorry if it was a little too long, how I got here. But what I omitted was the way I finally passed to work around blood. And aside from poking myself, like I said, was my mother. We didn't have hardly any money. And she paid for a doctor who was retired, who was a hypnotist. And I went to his house. It was a home office. And I was a little intimidated with hypnosis and all that. And he hypnotized me to just basically how to control that response, the vasovagal, using just my fingers. And I do it still to this day, not very often. But if it wasn't for that hypnotist,
it's amazing.
I wouldn't be talking with you today. I owe it all to that person.
Well, Phranq, it was wonderful to talk with you today. We really learned a lot. And
so much. So inspiring, actually.
Well, I love hanging out with Ted and Mary. We're still friends, right?
Even though you don't understand homeopathy, that's okay.
But the thing is, at the end of the day, remember, it's not always the two sides. It's just harnessing the larger aspect that, regardless, to be successful is fantastic. I see Ted laughing. All right, guys, I'm going to head off.
Right,
thank you so much for inviting me. I appreciate it. If you want to talk about prostate sometime, we'll do a call for that one. We'll do that. We'll do special prostate. If you have any prostate questions, Todd. All right. Thanks again, Todd, for your help. Bye-bye.
Well, that was fun. You have the best and most interesting friends, Ted.
Definitely. Phranq is a very interesting guy, very smart, and gives a lot different perspective than most people that we get to talk to.
Yes. Yeah, it was great having him on the show. We could have him on 5 more shows. And I think you and I should do a follow-up on the placebo as well. I think it's just such a great topic, and it's something that people can use, practitioners can use as part of the system. People need to understand its place in the system as opposed to demonizing it or fully embracing it, like just to really understand it.
Yeah, understand that it's part of the healing process. That you shouldn't be ashamed of it.
Right.
That is something that can be helpful and is, whether we like it or not, it's part of every piece of medicine.
It's true. Yeah. Everything. So it's not like we could get rid of it if we wanted to, because it's part and parcel to the system.
Exactly.
All right.
Yeah.
Till next time.
Take on Healthcare was created and is hosted by Ted Suzelis and Mary Sheehan. The information contained in this podcast is provided for informational purposes only and is not intended for the purpose of diagnosing, treating, curing, or preventing any disease. Before using any products referenced on the podcast, consult with your healthcare provider. Carefully read all labels and heed all directions and cautions that accompany the products. Information found or received through the podcast should not be used in place of a consultation or advice from a healthcare provider. If you suspect you have a medical problem or should you have any healthcare questions, please promptly call or see your healthcare provider. This podcast, including Mary Sheehan and Ted Suzelis, disclaim responsibility for any possible adverse effects from the use of information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations for warranties about guest qualifications or credibility.